tuned into Between You, Me, and the Speculum with Dr. Ju. Today's episode gets personal, it gets real, and it gets healing. Let's join the conversation as Dr. Ju delivers.
Hello everyone, it's Dr. Ju with Dr. Ju Delivers, and I want to thank you for joining me on my channel. But yet again, I wanted to share today. Today was a long day in my office, and I wanted to share. I'm going to share first from my professional hat, and then I'm going to switch it up and share from a personal perspective as well.
What happened that night? You said things were fine. What changed? What are you avoiding? Men, talk about it. Why can't we?
Hi, I'm Dr. Julianne Birt. 43% of women experience a sexual problem, yet they don't want to talk about it. We can help you feel the way you used to. So talk to us. Visit radiantwomenshealth.com today.
Long day, lots of patients, and I'm grateful. Practice is doing well. I see probably about 5 new patients a day, and that's on top of my already established patient population. But whether new or established, today seemed to be a theme. And that theme is that there are many people out there who are just not abiding by their doctor's recommendations. What do I mean by that? They have blood pressure medications that they're supposed to take once, twice a day. They haven't taken any. They are way past due, and I mean way past due, for preventative screening. Had a patient who is at least, about 15 years past due for her very first, and I mean very first, like ever, mammogram. Never had one. I have patients who, they have no idea the last time they had a colonoscopy, which should be once every 10 years, beginning at the age of 45. Mammograms at least annually, beginning at the age of 40. But nope, we've not done that. Pap smear? How old is my child? The last time I delivered a baby was in 19. If you aren't even starting with a 2, I'm concerned. Haven't had a pap smear, which should be done at least every 3, sometimes every 3 to 5 years. So there are just folks just walking around not taking care of themselves.
When did this begin? How long has it been going on? Did you think it would just go away? Men, talk about it. Why can't we?
Hi, I'm Dr. Julianne Birt. 43% of women experience a sexual problem, yet they don't want to talk about it. We can help you feel the way you used to. So talk to us. Visit radiantwomenshealth.com today.
So the reason why I wanted to pause and share is because of this, and I've got my personal hat on now. And I've been very truthful and honest with patients, and if you are one of my patients, you know how transparent I can be. So I shared this with my therapist on last week, and I told him that, this has been one trying season since March. What's that? About I'm getting close to 5 months. In the almost past 5 months, I have had at least 10 people somehow connected to me who have made their transition from their earthly realm onto their higher place. At least they're resting in paradise, waiting for that great getting up morning, right? But that's 10 people since March. The ages vary as young as 15, all the way to a long life lived, well lived, to 90. And all the causes or reasons for their passing, they do differ. But what I'm reminded of, and I share this with a patient today, said, why folks acting like COVID never existed? Now, this is not a COVID message per se, but why, like, folks have very short memories. Like, I remember wondering during that, those first few months, like, God, what is the message? What are you trying to show us? What are you trying to tell us? And clearly everyone came out of it with different life lessons. And for me, it was about taking time to share with family, friends, being joyous, not sweating the small stuff. But in all of that, as a physician, I can only tell you how disturbed I am at what I see. That people, I guess, some life lessons were just bunk it. We're just going to jump off this cliff and see how we land. Preventative services, preventative health screenings, the recommendations that we as your physicians try to share with you is for you to live. And live not just, quantity, but quality of life. If your blood pressure is high and, what you're doing ain't working, the processed foods, the chips, the salty meats that you like to eat, whatever it is, if it's not working for you, and you tried, well, I'm just going to do all natural. You tried, but it hasn't quite worked out for you just yet. Then take the medication. Take it. Schedule the exam. Do what you have to do to breathe and live. It is absolutely a concern of mine when I see people just ignoring. It's like we're back in COVID. Like, folks just ignoring the science. Like, that doesn't pertain to me. Nope, I don't need that. Colon screening, I'm good. But I digress. 10 people, 10 folks, whether they're family, like family, somehow associated with my family. And in the 10 deaths, the 10 lives that have transitioned, I've attended 6 funerals. Yeah, I talked to my therapist about that. I may need to stop going to funerals. But 6 in person, 2 virtually, and 2 I was unable to pull off for different reasons. But that's 10 folks. And that's not everyone that I know about. These are just the closest ones, the ones that really, hit home and impacted me. So let's do our part. Let's not try to make it to the grave any sooner than we must. Then our name is on the roll, but we have no idea if that roster is, at the early exit or the late. I don't know, but I need to do my part to live. So that's what I'm asking you. Don't put it off. Whatever that may be, if your doctor has made the recommendation, if they've written the prescription, discussed the therapy, whatever it may be, surgery, whatever option is you have chosen, after a very thoughtful conversation with your provider, let's do these things to do our part to live. How about that? Let's try it.
Content shared on Between You, Me, and the Speculum with Dr. Ju is for informational purposes only. While Dr. Ju is a licensed physician, the information provided should not be considered a substitute for professional medical advice. Always consult your primary care physician or healthcare provider before making any changes to your health or wellness routine. The views and opinions expressed are those of the host and do not represent the views of any medical institution or organization.